We're live from our studios here in Kokomlimle on digital address GA0992539. Our lead stories this hour. Are schools covering up and underreporting COVID-19 cases while parents are complaining? We hear from the Ghana Health Service on the number of cases recorded in our schools across the country and the National Schools Inspectorate Authority, which is urging school heads to commit to transparency and full disclosure. What are you getting from your child's school? Let's hear it. In 5 days since the shooting of a paramedic driving a woman in labor to hospital, police have yet to make an arrest, but says leads are being followed. Today, we hear from the woman who has now delivered, but been stigmatized and subtly accused of being the cause of the paramedic's death.
They took everything we had and even disconnected the things in the ambulance and demanded money.
Also coming up, to get into the witness box or not. Today, counsels for the sides in the Supreme Court hearing have been arguing out their reasons why chairperson of the Electoral Commission should or not be cross-examined in the witness box. The judges are set to rule on the matter on Thursday. We bring you the highlights. And the pulse is brought to you by Global Communities Dignilu, affordable, safe sanitation. Do join us on DSTV 421, GoTV 144. Remember, we're streaming live on YouTube and our social media handles. Send us a WhatsApp, and today in particular, we want to hear from you if you have children in school or you think you have an opinion on that particular subject. The number is 0540109009. My name is Gifty Andopia. This is The Pulse. Please be my guest. And I'm expecting to hear from you. This afternoon, the National Schools Inspectorate Authority is warning schools not to hide COVID-19 cases that they record in their schools. These follow reports of increasing cases of COVID-19 reported in some schools. However, there are concerns that some school heads may be covering up the number. Are you concerned as a parent or a guardian about this situation? Do join us with your thoughts. As I said, I've given you the number already. Would love to hear from you, but let's take a look at the case count right now. There you have it. So our confirmed cases so far since COVID-19 started is 73,003. But so far, the number of deaths continue to go up. 482 people have died because of COVID-19. And as it stands now, the active cases, the persons in this country who are currently recorded to have COVID-19 are 6,938. And it certainly gives you an idea to the extent to which the numbers are going up. Let's now bring you an update on the number of cases in our schools, particularly in our schools. Let's start from the Akonsomo International School, which is in the Eastern region, where 5 more people have tested positive. And that brings the number of positive cases in that school alone to 84. 5 senior high schools in the Upper West, the Greater Accra, the Western and Eastern regions have so far recorded positive cases of coronavirus. That's across the board. And speaking at the Ministry of Information's press briefing, the Director General of the Ghana Health Service, Dr. Patukuma Boaji, revealed that 23 schools in the Greater Accra region alone have so far recorded a total of 56 positive cases. He says no deaths have so far been recorded, with all the infected persons being asymptomatic. Listen.
I mean, 1 is high, but it's comparatively, I wouldn't say it's an alarming number. That is because this was expected. It was expected in the first 3 to 4 weeks. Because people are going to move from home to school, you're going to have some cases, as happened in the previous exercises. But over time, we are hoping that with the tightening of restrictions, adherence to protocols, we will actually get it better. We've had upper senior secondary school outbreaks in Upper West, Western, Greater Accra, and Eastern region. 23 schools in Greater Accra have so far reported 56 cases and no fatality. And I must show that parents have duly been informed. So if I come to that, we can look at the spread of the schools that are, then we have averagely 23 cases and total recovery 0 among others. But you can see that we also have some suspected cases of about 166 that we are still following up to see. And we have some staff also affected in the schools. Central Region has also reported, okay, let me talk first about the Akosombo one. As at 28th of January, a total of 500 in the Akosombo International one that has always been in the media. As at we had done a total of 553 samples have been tested, with 82 of them being positive. Students were 73 and 9 staff were positive. A total of samples have also been collected and tested, with 13 confirmed positive. That's after the 31st. And so that brings the total number tested to about 600. That's almost the entire school has been tested. This was a result of a positive case at home that they decided to do a test. The Greater Accra, the national and the regional team has visited the school, done our assessment, given our recommendations on how to improve the social distancing among others protocol to cut down spreads. And so all of them are well and isolated, and those who are close contacts are still being observed so that we can contain the spread. Central Region and the whole region has reported 8 cases from about 7 or so schools. 2 of them have already recovered, so they have 6 active cases among the schools in Central Region.
And that's Dr. Patrick Kumar-Boaji there. You'll be hearing from a virologist, but just a quick look at some of the messages you're sending on the back of this particular story. This one says, getting students to comply with protocols is not easy. As a teacher, you have to constantly remind them to wear their masks. When you leave the class or not around them, they take them off. Some also wear it wrongly or put them in their bags. Achim Krachi Kumfio Cham is sending that message, so that gives us an idea the problems that the teachers also say they're facing. Well, let's hear from the authority that has been going around checking with the compliance there, which is the National Inspectorate, the National Schools Inspectorate Authority, NASIA. They've just released a statement there, and that's what you're looking at right now. Let's take a look at it. It's pretty short. It says, reports reaching the National Schools Inspectorate Authority, formerly the National Inspectorate Board, indicates that some schools have recorded positive cases of COVID-19 but have refused to disclose the information either to the relevant authorities and the parent. These reports have been received from mostly concerned parents and members of the general public. The next paragraph says, we are, by this press release, strongly urging all schools to adopt an all-hands-on-deck approach to defeating our common enemy, the coronavirus, and commit, take note of that line, it says to commit to transparency and full disclosure when a case of COVID-19 is recorded on their school premises. We also wish to remind all schools that our team of inspectors are currently conducting COVID-19 compliance inspections in schools nationwide, and we count on the cooperation of school leadership to ensure full compliance to COVID-19 protocols. In that final statement, the final paragraph, the statement says that as the country continues to record COVID-19 cases, NASIA remains committed to ensuring the health and safety of all learners and staff. We therefore urge schools to put all the necessary measures in place to prevent an outbreak of COVID-19 and report to the Ghana Health Service and NASIA immediately when a case is recorded. Parents are also advised not to send their wards to school when they are showing signs and symptoms of COVID-19. And as parents, they are alerting you to also alert the school authorities immediately when a member of the family tests positive. So we're urging you to share with us as well your concerns and your experiences from the schools so far since they were opened. And I see some of you sending your messages so far. The concern has been whether or not we have reached a level where the schools have to go back to being shut down. Some have made arguments for, others have made arguments against. Listen to a senior virologist at the Kumasi Center for Collaborative Research, Dr. Michael Owusu, who is asking government to take a firm decision to close down preschools kindergarten and lower primary schools. His call follows the outbreak of the infection in some of the schools here in Ghana, whilst others are struggling to comply with the COVID-19 protocols.
I think that there are some possible increases in cases across school. But my worry is that for the upper primary, junior high school, senior high school, and tertiary school, by the protocols that the GS has ruled out and for who the Educational Service has ruled out, they are able to comply to some level. Which will mean that even if there are infection, possibility of isolation and contact tracing is possible to some percent, to some level, this is workable. But my major concern is those who are 6 years and below. It looks as if implementation of the protocol is not very practical. These are children that ever since they opened, if you have observed across board, wearing of masks is very difficult. 1 year, 2 year kindergarten children, it's almost extremely difficult to ensure that they observe the protocol. But the difficulty is that these children are now going homes to their parents and then infecting parents' home, and parents are rather getting sick and being hospitalized. So although they may have short-term fever, they may recover quickly, but then they don't spend their parents at homes. And this is where we need to look at. If we have to tackle schools, I don't think that closure of all schools is necessary. But we may begin by looking at the kindergartens and the lower primary, where we think that it is extremely difficult to fully implement the protocol, and then perhaps close these ones and then observe how the numbers will play out. As you have mentioned, for me, the main outcome measures, which is the hospitalization, the deaths, and the new cases, does not seem to be improving. Things are getting worse, which will mean that the announcement made by the president needs to be enhanced for us to step up other measures that will ensure that we are able to reduce the new cases coming up, reduce hospitalization, and reduce deaths.
Well, that's a virologist there speaking to Aisha Ibrahim last night on JoyNews Prime. Well, some of you seem to agree with the point that he's making here. This one says, I think government should close down the lower primary schools. But then you say that we as citizens also need to help the government to deliver on this mandate. It says to observe the protocols. Security agencies have to also step up their work. Sir Willie sends this from inside Denu. Thank you very much for your message. But some of you are also raising concerns about the COVID fund. We'll talk about that. Let's go to another person, an immunologist at this point. He's at the West Africa Center for Cell Biology and Infectious Pathogens at the University of Ghana, Dr. Yaobediako. He says government ought to review the current protocols when it comes to our schools. He also adds that the existing protocols may not necessarily be as aggressive as we need in tackling the virus, which keeps on, as he says, mutating. He spoke earlier today on the Super Morning Show.
The issue of, will students get infected? Yes, if they're going to school, you will have students who are infected. The science still shows that children are still somewhat more protected or are less likely to get infected than adults. But saying that doesn't mean that they are not getting infected. There are children in this country who have died of COVID. So it's not as if children are immune. It's just that if you compare the number of adults who have died, the number of children who have died, there are many more adults. Now, that was partly because for a while children were stuck at home. In the US, when they opened schools, they showed a dramatic increase in infections. When schools were closed, less than 3% of their infections were in children. When schools opened over a number of months, that proportion went to 12%. So it went from less than 3 to 12% just because now kids were out.
Right.
But that's still 12% out of the, so that means, well over 80% of the cases were adults.
Yeah.
So children versus adults, children still seem to be somewhat less susceptible. But if it's my child, right, who is part of that 12%, well, I may have, percentages are nice when till you are in that in that statistic. So I think we have to begin to ask ourselves, if we want schools to stay open, what are the measures that need to be put in place? For where I sit, in my opinion, that is where we are right now. I think we need to evaluate what we are doing to protect children. Simply saying we've set up hand washing stations and giving children face masks, I don't think is enough.
Right.
Given the burden of disease we have, typically schools are a reflection of what's happening in the community. If there's a lot of COVID in the community, you will find COVID in schools. If you control COVID in the community, you also then control it in the schools. So we need to ask ourselves, how are we following these outbreaks? Are we simply waiting for children to get sick and then saying, oh, let's go and test a bunch of people? Or are we being proactive? Now, the FDA has approved antigen tests. Antigen tests are significantly cheaper than PCR.
Yeah.
A number of us have been calling for Ghana Education Service to work with Ghana Health Service to deploy antigen tests in our schools. You could have a system where every week you test a random sample of 10% of the students in the school. That would give you a very clear idea of what the burden is. And I suspect in some parts of the country it to be very, very low, and other parts of the country to be higher. Once you've got that baseline information, then you know where to target your resources, and perhaps which areas you may have to shut down temporarily if you hit a particular threshold that you set out.
Right. Thanks for that.
Dr. Bediako there, he is an immunologist. Well, let's head to the Ashanti region, where the regional chairman of the Ghana Medical Association, Dr. Pakwesi Beidou, has a different alternative. He believes that government should come up with a threshold at which schools should be shut. He also spoke on the morning show.
We agree as a nation that if we have a threshold of 10% or 20% and we hit that ceiling, we in the medical fraternity, that's the Ghana Medical Association, will not hesitate to call for the schools to close down or be suspended in view of what has happened, what we have all agreed on as a nation. And that's exactly what was said.
Thank you for that. Thank you for that clarification. And of course, Winston is here. I think he has a question for you.
Yeah, so
that's okay.
Yeah, so Dr. Beidou, talking about the debate, and epidemiologist Dr. Ernest Kanu makes a point. Just so I can get your thoughts on it. He said that, look, we know the science. What matters now, it's our behavior. And so if we're ever going to win this war, it depends on our behavior, and we should ensure that we enforce the COVID safety protocols. Would you say that if we decide to enforce the protocols, if we decide to have the right attitudes and behavior, we may not need to have this conversation, because then we would be able to deal with the virus?
Yes, I agree. You see, now we do understand the virus, how it starts. I mean, the pathophysiology, the processes the virus goes through before a person is infected, what it does to the body and what the body does to it. And we've realized, and it's not only here, for the vaccines, some countries have tried and they've won the battle before even they had the vaccine. It's attitudinal change. The president issues a statement, don't do this, don't do that. Funerals should be, only private funerals should be allowed. You go to your partner and you have more than 200 people. It's an everyday thing. Wear mask, sanitize, social distance, and all these are not being done. You test positive, quarantine yourself. You said no. You go to work, you go to parliament, and that's what is happening. We are hearing of people who think if they report to their employers that they have the virus and they are absenting themselves, they will lose their job, so they will keep quiet and spread it. So I agree. It's more of an attitudinal change. And I use this term now, it's becoming an existential threat to our very existence here on earth or in the country. And we are urging, or we urge each individual to take this fight personally.
Well, let's hear from the Director General of the Ghana Health Service. He says surveys conducted by the service in 43 communities in the Greater Accra region reviewed the adherence to the wearing of face masks has actually gone up from 42 to 47%.
So in conclusion, the wearing of masks already has increased from 42 to 47. Those not wearing masks at all decreased from 26 to 29. Base mask wearing is generally better in the morning than in the afternoon. And this applies to both adults and children. 55% of children wore masks correctly in the morning, and it dropped to 29.5% during the late afternoon. 51% of adults who wore masks correctly in the morning dropped to 43% late in the afternoon. So it looks like the afternoon is something we need to really make an effort to ensure that people keep their mask on in the afternoon. And also increased generally, even the morning one. Generally, correct wearing of the mask has seen an improvement in some communities that we visited. For example, in the previous survey, University of Ghana main entrance, we had 78% of the people who observed found to be wearing their face mask correctly, compared to 84% in the latest survey. Another example is the Nima, where nearly 70% of people were not observed wearing the face mask at all. In the previous survey, declined to 67%. And so there's an appreciable increase in the adherence to the protocols.
Patrick Kuma Abwaje there. I'd like to take a quick break, but before that, some of your messages. This one says, he says, I think that this is the right time for the government to absorb and post nurses to schools, at least one at a school, so that they can work, okay, I'm not sure which word is that, with the teachers to help handle the COVID-19. How do you detect a student to be positive for COVID-19 when there is absolutely no testing ongoing in our schools? John sent that message from Keta. This one says, my concern is how we treat the reusable nose masks after using it. Some just fold it and keep it in their pocket. Some won't wash it. In fact, it is really serious. David sent that message. David, thank you. This one says, I think, Gifty, that not only kindergarten and preschools can't follow the protocols. I am a teacher in the junior high schools and I'm in charge of nose masks and social distancing. I tell you, it is difficult even trying to enforce nose mask wearing. Once you turn your back, most of them will remove the nose mask. In my candid opinion, all schools should be closed. Let's not wait for things to escalate. Gaddafi send that message from Ada. Gaddafi, thank you. This one also says, Gifty, please find out from the government what is going on to provide furniture for the schools that are lacking furniture, because it is difficult controlling physical distancing. But if there were enough furniture, then the control would be a little bit easier. Then Yina Eugene sent that from Tra in the Bono region. Let me take this very final one. And then we go on. This is from Yaba, who is sending us a message from Takra. The Yaba says schools should be closed down until the vaccines are in. Keep your messages and your thoughts coming, especially if you have a child in school and you suspect that the school is not reporting correctly whether or not they've recorded any COVID-19 case there, because that is the concern that is coming out pretty strongly. This is still The Pulse with me, Gifty and Dopia. Today we're looking at the situation in our schools. We'll take a break. When we return, we'll go across the regions. Today our focus is on the Upper West region. Rafiq Salam will be joining me. There's an interesting development there. We'll tell you about it. Please don't go away. Stay with us. Welcome back to the show. Many thanks for staying with us. Now, the number of cumulative COVID-19 cases of the Bono East region since the outbreak of the pandemic stands at 845 with 15 deaths. Regional Health Director Dr. Fred Adomako-Boateng disclosed this to JoyNews' Anas Sabit, that even though there has been improvement with regards to adherence to the safety protocols, the region has inadequate facilities at the district levels to manage the cases. More in this report.
If you look at the COVID situation in Bono East, it's not entirely different from what we are seeing in the country. But nevertheless, our numbers are not comparable to what Accra and Kumasi are experiencing. Since November, the middle of November, the figure that we had was static, was there till the beginning of this, actually the second week in January. So you can see, and this is quite deviation from the first case that we referred last year, where we had one and it took about 2-3 weeks before we had the third and fourth. And if you really look at our graph, you can see it's beginning to rise. And we know at least once you see about 15-14 people, you can project the people who are exposed.
In terms of adherence to the safety protocols, Dr. Fred Adomako-Boateng tells me the situation has improved over the past few weeks.
The protocols, I must admit, is improving. It's really improving. Even among health workers, the places that have been, it's improving. But I think we really have to quantify. I think now people are getting it. but we are not where we want to be. The understanding is dawning on people that, look, COVID is really real and COVID kills. The young people can also get COVID now, as compared to last year, where people were doubtful in terms of what we were discussing. I must say that there is improvement. If cases are supposed to be managed in hospitals and you don't even have the hospitals, then obviously, from the word go, you are already defeated. So that's one of our fears. Secondly, you see the way the cases are coming now as compared to initial cases. They are coming in huge numbers. And that's what we have to avoid. Because imagine that you have about 50 people at a go that you have to support them. So that you see that people start dying, not because the virus is killing them. It's because we can't provide that support. And so we cannot afford to go the one because we don't have that level of expertise in Bunois, all our hospitals, with the exception of, let's say, Holy Family Teaching Hospital. So you can see by in the infrastructure and the skill that we have, we are at disadvantage.
He therefore encouraged the people to strictly adhere to the preventive protocols as prescribed by health authorities.
Because of you can have unnecessary death from mothers delivering. You can have unnecessary death from cardiac failure, emergency surgery, accidents. So you see all kind of vicious cycle that the COVID has put us into. So it's important as a region. Our main goal and target should be prevention.
Reporting for Joy News, Anas Sabit, Tichima.
Now, the Central Regional Police Command has taken the initiative to collaborate with traditional authorities in the region to distribute face masks and sanitizers to everybody there. The Police Command says combining enforcement and sensitization is the surest way to reduce the spread of the virus. Let's hear from our correspondent in the region, Richard Kojonyako, in this report.
The Regional Police Administration partnered traditional authorities in Oga to share face masks and sanitizers days ago. They did not end it there. Now they are moving from one town to the other, enforcing the wearing of the mask, the distribution of it, and sanitizers to the people as well. Regional Police Commander DCOP Habib Achumesi Sapon was at Elmina and partnered the traditional authorities to sensitize the people and distribute the mask donated to them by Castle FM, a radio station in Cape Coast. She asked the people to, as a matter of necessity, abide by the protocols.
We cease to achieve the buy-in of the wearing of the nose mask. We are enforcement agencies. We are supposed to enforce it. We are going to enforce it. But we want to enforce it together with sensitization, and that is exactly what we are doing. And we are doing that by also looking for donors to help us. That is why we're able to share nose masks and the sanitizers to the public. We want to encourage them to wear them, to protect them, because our responsibility is protection of life and property. And whatever it takes for us to do that, and that's exactly what we are doing. After the sensitization, we are enforcing. We are doing it together. So we will enforce it and prosecute them when necessary.
The Omahine of Edna traditional area, Nana Kojo Kondia, asked the people to abide by the protocols that have been put in place by government to reduce the spread of the virus.
They are about to task them. President, let's share no dabano. One bomb as in the bedido. Mama,
we are pleading that the government directive on the protocols must be adhered to. This is not a time for politics. In Ghana, we play politics with everything. This is a disease. It knows no political color. We should team up with government to follow the protocol. The Central Regional Police Command would, in the coming days, continue to undertake the exercise in other parts of the region. Richard Kojonyako, Joy News, Cape Coast.
Well, this afternoon, we're heading to the Upper West region. We'll take a look at the COVID situation there. Well, the police in Wa have so far arrested 83 persons for failing to wear the face masks in public. The arrested persons include 17 females, 66 males. Although the region continues to record increasing cases of COVID-19, the compliance to health safety protocols remains a challenge there. And this has also compelled the police to make those arrests. JoyNews' Upper West correspondent Rafiq Salam has a report.
following the fiat from the president a couple of weeks ago, ordering the Ghana Police Service to ensure the strict enforcement of the wearing of nose masks by the people. The Upper West Region's Police Command for a week first engaged in the vigorous sensitization of the people at churches, mosques, and markets on the need to adhere to safety health protocols, especially the wearing of nose masks. The Upper West region has so far recorded 220 COVID-19 cases. 65 of the cases are active, 4 at a treatment center, 61 attended to at homes, and 8 deaths. Despite the sprawling figures of the new cases, the people seemed unconcerned, thereby forcing the Ghana Police Service to this morning embark on a special exercise to arrest persons who failed to wear the nose masks. 83 persons were arrested in the 1-hour exercise. Chief Inspector Gideon Boateng is the Upper West Region's Public Relations Officer of the Ghana Police Service.
At about 9 o'clock in the morning, the command went out there. We went to some places like KJTR here in Wa, the main traffic light, the headquarters roundabout here, and then the NIB area. We were able to arrest 83 people comprising 17 female and then 66 male. They all paraded here at the regional headquarters. They were speaking in the north shed. They were giving warning letters to go and be of good behavior and to comply with the COVID protocols. And the next time they will be, their names have been put down. And whenever they accost any of them, they will be put before court.
All 83 persons arrested were each given nose masks by the police.
There are some of them, the moment they see the police, they were having them in their pocket. You see them struggling to remove to wear. Those people, we warn them on the spot and tell them that we let them understand or know the essence of wearing the nose masks and the social distancing. I mean, the protocol to be observed. And then they did understand for that material time. And others too, you see that they don't have it at all. Those that we brought here today, they were not having it. When we arrested them and we were conveying them to the station, the regional headquarters here, where we paraded them, was when we bought an issue to them to wear, because we were conveying them in vehicles we brought to the regional headquarters here. And therefore, perhaps somebody might have been infected, of which that person may not know. So we issued the nose mask to them to wear, let them board in the vehicle. We brought them here, and then we started advising them.
After the arrest, there was a lengthy admonition from the police command, and some of them have opted to be voluntary ambassadors for the COVID-19 fight.
I will never work without nose mask, or even be in the public or any private place without nose mask. Even if I'm even sleeping, I will even use nose mask on that. I will also advise my friends, and also make sure that passengers who join my car, I will also share nose mask to them, and also issue a warning to them.
I have to tell them the COVID-19 is real, so they have to wear the nose mask and give social distance and those things, and listen to the president directive.
Reporting for JoyNews, Rafik Salam. Wow.
And I'm taking you to the region right now. Dr. Damien Punyiri is the Upper West Regional Director of Health Services. Doc, thank you for your time. Good afternoon.
Good afternoon.
Let's start with your case count. What are your numbers, and what are they saying to you now?
So currently in the region, total case count is 251, and active cases are 64. Currently, 4 are severe and are on admission. The rest are being managed. 11 are moderately ill. So that's the situation in the region.
4 are severe and are being managed. How severe are these 4 cases, and how are you coping with dealing with it?
Yes, so currently the 4 severe cases are in the regional hospital, which has ventilators, but currently none of them need to be ventilated as of now. essentially mild difficulty in breathing and other bodily aches, and so they are actually being managed, not on ventilation, but on oxygen. And also the others are also, few others are also in other treatment centers, basically on, just on precaution, they are moderately ill.
So the 251 cases that you have, this is as of, can you give us a little bit of how it snowballed to this level? Was it better as of January? How many cases, for example, did you have in January? And so that we can tell the difference.
So, you remember up to December, let me say up to November 2020, our total case count was 96. And then we started reporting few cases in December, about 4 in December. And then from the first week of January through to now, we saw that the cases have been increasing and increasing. So currently this year alone, we are 154 against the 96 as of 2020. So that's the situation in
your total number of 251 may be relatively small, but it looks like it has really spiked.
Yes.
Has a spike between just December and now.
We have more than doubled our number from the first week, and this is just over 5 weeks if you look at the whole period. And so you can say that there's a marked increase in the number of cases reported in the region. And this is something that we are dealing with.
Exactly. And I'm wondering what your expectations are. Because with the numbers that you have, I'm expecting that you would have started doing contact tracing, which essentially usually will give you a bigger number again.
Of course, that we are doing the contact tracing for every case that we identify, and it is a contact tracing that has gotten us up to this level.
Okay.
Few will come with symptoms, and then when you do contact tracing to the family and to the community, then you get more cases. And so it's a snowballing effect. You get a case, and then you trace, and then more cases come out. So the number keep on increasing. If we stop contact tracing, the number will drop. But of course, people will certainly come down with it. And so we're doing effective contact tracing, and that's why the numbers will keep on increasing. Whilst efforts are being made to ensure that people adhere to the protocol that have been put in place. As you can see from the region, what the security services are doing together with us.
What can you report regarding your schools or schools in the region? What is the story there, Doc?
So, for the schools, so far 8 of our schools have reported at least a case. We have traced all these cases. Majority are traceable to different communities. I mean, before, most of these cases were picked on arrival, the first week of arrival after the reopening. And we saw that they came from different locations in the country, including our own region. And so, for example, in 7 of the schools, we picked only one. We did contact tracing to the schools and then to their communities. And so for the 7, we haven't identified any additional case in the school, but for the one other one, we had a few more cases. So that is the situation in the Upper West region. And currently, I think the cases are doing well. I can say that the region has reported a total of 28 cases among students. 5 have recovered, a few more will recover. Currently, 8 are being managed in treatment centers. Basically, precautionary. The others are on isolation in the school compound. I mean, the schools have identified places we deem fit to keep them. And so that's the situation in the school.
So help me to understand. I just want to clarify this. You have recorded 88 cases in 8 schools.
No, please. I'm saying that 8 of our schools reported at least a case of COVID.
Okay.
I mentioned that of the 8, 7 reported just a case each. And these cases were traced to family outbreak. We did contact tracing, and so far it hasn't yielded any additional cases in these schools. But for one, we have few more cases. You know, we investigated not necessarily from one person from different communities, but about 3 different communities that these cases came from.
I think I got that. What I didn't get was I just wanted to clarify that you have reported in the region 88 cases among students across the region.
No, I said that 28
Oh,
cases.
28. Sorry. I had 88. I know. That's why I wanted to clarify, just so we don't get the figures wrong. So 28. 28 cases in the Upper East region among students, but then the cumulative figure is 251 for everybody else. What I'm hearing also, our correspondent is reporting that people are still not adhering to the safety protocols, although the police has made some arrests. How worrying is this situation for you in the region, and what is the strategy to deal with it health-wise?
Yes, so it's a situation that we all are worried about because, as you can see, the numbers are more than we anticipated, and the transmission is looked to be quite high. And you expect that the people will adhere to these protocols. It seems, I mean, the adherence is gradually picking up, but we are more concerned about even the right use of the nose mask, not just having the nose masks, but consistently putting them on and ensuring that they don't put them on when they see the security services. So what we are doing is we're engaging with various groups. Yesterday we were with the GPRTU leadership, who also have formed a task force to ensure that the cars arriving or leaving their station, they make sure that all the passengers are on mask. And so we are also engaging the school authorities. The various district assemblies are also meeting and taking measures to ensure that people comply with these guidelines. But more importantly, we're educating the public on the importance of wearing the nose mask, not just because they have to comply with the law, but the fact that it saves their lives and it saves other people. So that is what we're doing in the region.
There have been concerns this afternoon by the National Education Inspectorate Authority that teachers or heads of schools seem to be, engaging in some level of non-disclosure when they record COVID-19 cases. They are not reporting it. Is that a problem for you in the region as well?
Well, I would say that there are reporting guidelines. So when I believe that they usually will report to the appropriate authorities. When we get cases, we inform them, and we expect that they will inform their authorities. But of course, before you do that, I mean, you should not just be disclosing to the general public before the relevant authorities get to know, because we have a hierarchy where that we have to respect when we are giving out this information.
So it is not the case. It is not the case for you in the region that heads of schools are refusing to report when they record COVID-19 cases.
I won't say that it's a problem for us in the region.
Okay. Okay. Doc, is there anything else you'd like to share, perhaps for people who are watching you from the Upper West region to understand the seriousness of the situation? You can take it away from there.
I really want to encourage residents, to adhere to this safety protocol, particularly wearing of nose masks. This is the best vaccine for now that we can really use to protect ourselves. Visiting crowded areas should be only when it is necessary, and as much as possible should be very, 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 very short. Like going to the market, you plan what you're going to do, you get in there and do it and go out. The teachers, I think, must also include the protocols. I mean, because we're not going to stop these things for now. So we need to really incorporate that into our learning in the school, teaching the school children to consistently wear them. You know, right now when you meet school children, they all have masks. Unfortunately, when they close from school, they just put them in their bags, and then when you ask them before they start reviewing them. We need to really inculcate in them that they need to consistently wear these nose masks, and I believe that if we all do all that together, we can contain the disease.
I guess that the problem has been for especially the very young ones.
Yes, the
understanding that this has anything to do with my health and whether or not they care. But so then they're having calls for primary schools, kindergartens, for example, to be closed down again. Are these concerns that you, does this resonate with you?
Well, I wouldn't have, I wouldn't want to say anything concerning that, because I know these kids, I mean, in the class, they really put on their masks. The only time that they do that, they will remove them is when they are going home. During that period, they are also in the open. So the risk of transmission is quite less. And children are easy to convince. So that's why I say if we consistently teach them what they need to do, and that it is for their benefit, I believe that they will be able to adhere to this protocol for the general welfare of all of us.
Okay.
And so I don't think, I mean, calling for closure of primary school is neither here nor there.
Okay, Doc. I wish you all the best, and we'll see how it goes. Hopefully, the children will understand that when school closes, it doesn't mean that coronavirus has closed, and that they will keep their masks on even when they close. Dr. Damien Ponyinere there, who is the director, health director for the Upper West region. Let's bring you back to the capital. The minority in parliament is demanding the immediate dissolution of the government's technical team on COVID-19. According to the opposition MPs, the surge in cases associated with higher mortality rate is as a result of the poor handling of the virus by the technical team, according to them. That's not all. The NDC caucus in Parliament also alleges that the formation of the technical committee was purely based on partisan lines, and they are insisting that they must be blamed for the rise in cases across the country. The minority spokesperson on health, Kwabena Minta Akando, believes the recomposition of the technical team would be the first step in decisively dealing with the rise of COVID-19 cases here in Ghana.
The political nature of the team, that is why I think that that team must be dissolved. But it is basically, our session is based on competence, because if they had looked beyond their political spectacles, I think that they could have identified more competent people to handle this particular issue. And you all bear with me, there's nothing we are saying today on COVID that we haven't said before. All of you here will bear with us. But it is because of the political spectacles they are putting on, that is why we are where we are at the moment. At some point in time, even when we are saying that cases were rising, some of them, I mean, come out to say that we were lying. You understand? So I think that they are incompetent, and therefore it must be dissolved to get more competent hands to handle the situation. And then the issue about lockdown. Well, if we put the necessary measures in place, I don't think that at this point in time we should be calling for a total lockdown. You understand? But if we are talking the walk all the time and we are not walking the talk, okay? For example, government gives directives to schools to be reopened, and then you get to the schools, especially on the first days, there's absolutely no PPEs at any of the government schools. You are virtually spreading the virus because it takes a second to be infected with the virus. You know, as I speak to you now, if you go to most of the constituencies, some of the basic schools are without a thermometer. Thermometers are not distributed as part of the PPEs.
Let's head to Parliament now. My colleague, Kwesi Parker-Wilson, is joining me with more. Hello, Parker.
Hello, Gifty.
Parker, so we know that a number of things have happened in Parliament, but the concerns that Governor Aminta Kando is raising, has it been, has it had any responses yet?
Not yet. In fact, Parliament just started about 5 minutes ago, and we haven't been able to get the majority actually to get a reaction on that. But I personally approached a few of them who told me that they are yet to listen or verify the claims being made by Governor Aminta Kando, and that when they get any better responses, they'll let me know. So for now, the majority is yet to officially respond on the matter. But just a while ago, the minority leader, Haruna Idrisu, also made some calls this evening. In fact, he is asking for the immediate withdrawal of armed military men detailed to protect security to some government appointees. Well, he actually cited examples where some armed military men were captured on, viral video and also photographs holding backs of some government appointees. He believes that that is not the role of the military, and that if the police are not resourced or perhaps are weak, for that reason, they have decided to detail the armed military men. Then government should, as a matter of urgency, quickly resource the Ghana Police Service so that they carry out their mandate effectively. He also touched briefly on the armed robbery cases that is going on in the country. According to him, since 2017, the Ghana Police Service has failed to provide the statistics, the crime rate statistics in the country, and that they are asking the police service to quickly make that public so that it will guide the movement of some other citizens.
Parker, you've also
so these are some of the calls.
Sorry, I lost you there briefly, but you've also been talking to Sam George, who's an Ingo Prampram's a member of Parliament, about COVID-19. He has some concerns about the vaccine or the vaccination plan.
The minority leader, Haruna Idrisu.
Hello, Parker. Yes. I see that you hear me now. I was asking you about your conversation with Ningo Prampram's member of Parliament, Sam George. He has a concern. He's actually calling on government to roll out a comprehensively outline our vaccine rollout plan. Why?
Right. Well, so his concern is that he's already picked up information from his sources within the corridors of power that persons with underlying condition and also the aged will not be given the vaccine, which for him is a cause of worry because say elsewhere or in other countries where they are practicing the vaccine or probably giving the vaccine to their residents or citizens, persons with underlying health conditions and also the aged are the ones who are really benefiting from the vaccine before they come to the youth or the youngsters and probably the children. And he doesn't understand why here in Ghana, government is saying that persons with underlying health condition and also the aged will not receive the vaccine. So he wants government to detail the rollout plan for the vaccine. When is he arriving? Which persons or which category are we looking at? Are we going to give to the aged? If not, what are the reasons? Those with underlying health condition, if you're not giving them, what is the reason? So these are some of the things that he was explaining. It was very brief. It was very brief in saying that, but then the point I was making was that government should quickly let us understand why they have decided to go on that tangent, because he thinks that that is not the way to go, because we need to protect the aged and those with underlying health condition, and that is why he made that call.
Well, Parker, what else is happening in Parliament? Bring us up to speed and then we can call it a wrap.
Well, so Parliament is, as I mentioned, they will be sitting for long today because of tomorrow's event. The appointment committee will be vetting ministerial nominees. They'll make just a few statements. So we are hoping that in just about 30 minutes to an hour, Parliament would rise they'll go home. Tomorrow they'll return to vet the minister. But then the minority leader, Haruna Iddrisu, says that, well, tomorrow they are going to make sure that they do what is right for the people of this country. They'll make sure they vet the ministerial nominees who are coming in. But one interesting thing is that, there's already a schedule for the ministerial nominees. And tomorrow, the health minister nominee and also the national security designate, the minister designate, will appear before the vetting committee. We do understand that because of the rise in COVID cases and also cases in some schools that have been recorded, some positive cases, they want to reschedule some of the nominees and rather make sure that they vet the education minister designate so that they can quickly go and then check on the COVID situation, because they need a substantive minister for that sector to look at the issues within the schools and, of course, the rising cases among some of the schools. So these are some of the information we've picked up. And, of course, tomorrow we'll be following the vetting. But the MPs are saying that they are ready. In fact, the chairman of the appointment committee says he's ready and that we should have confidence in them that they're going to do a good job for the people of this country. But then they are insisting that they don't want any candidate to appear before them with their supporters because of the COVID situation. Not one, not two. Earlier, they had advertised that they were asking for about 5 people, but as it stands at the moment, they are only going to ask that the nominee should appear before the committee and not the supporters as well.
I'm sure that they're mentioning this because you've usually seen people coming for vetting and they essentially come with an entire entourage. Parker, thank you very much. Kwesi Parker Wilson is my colleague. He's in Parliament for us today, joining us via Zoom there, bringing us up to speed on everything that's happening there. Well, very soon the vetting will begin. But members of Parliament, especially those on the minority side, have concerns about COVID-19, which they've been raising. And some of them have been talking about vaccines, and talking about that, we know that even though South Africa received its bit of first tranche, if you like, of the COVID vaccines, it doesn't seem to be working, and so they've had to put that on hold. We're going to take a break. When I return, we go live to South Africa, find out what the situation is, what can we learn from the South African experience. Do stay with us. You're welcome back. Now, the World Health Organization is warning against jumping to conclusions about the efficacy of coronavirus vaccines. This is after a South African study suggested that the AstraZeneca jab was less effective against the local variant of the virus. But experts are hopeful that the vaccine will still be effective at preventing severe cases. We'll go live to get into the details of the vaccines. Joining me via Zoom is Audrey Chimwanda Fuala. She's a journalist and news anchor with Galaxy Universal Network. Audrey, thank you very much for your time. Let's take a look at your case count. How are the numbers looking in South Africa?
A very good evening to you and to the viewers. The numbers have been looking very good of late. As you know, South Africa has had one of the largest numbers of infections across the continent. We've been experiencing what is called the second wave of infections. But just taking a look at the numbers that were released yesterday by the head of department of health, we seem to be doing really well. And it appears that, the main provinces, like the capital in your Gauteng province, where I'm actually talking to you from, where there is the capital city, that's where the hotspots would then be realized. But otherwise, looking at the curve, it's really going down. We're looking at a cumulative number of just under 1.5 million cases at the moment. And, since SA began its second surge, however, 183 people are confirmed to have died as of yesterday alone, which is still a relatively high number if you compare to other countries.
That's terrible. That's a difficult situation to deal with. But South Africa has been able to handle it up until this time, with some restrictions and some other interventions. What restrictions are still being implemented at this point to deal with the situation?
So just about a week ago, we had an address from the President, Cyril Ramaphosa. We actually had to go to a bit of a stricter lockdown. We are at level 3, which speaks to, your congested areas like your taverns, your gyms having to be closed, the sale of alcohol having to be banned. But all that has actually been, released of late. People are able to, buy their alcohol, which really has been such a huge relief to some people who enjoy having their good time. Gatherings at church also are being allowed at the moment because the department is very confident that they have a good hold over this, especially the new variant that we're having to deal with in South Africa at the moment. I'd like to believe you'd have heard of it. We got our first batch of vaccines that came just a few days ago, which still has a bit of problems, and I hope that we'll be able to get into it a bit later on. But in terms of our beaches, our open spaces, our parks, they're all open at the moment. Your churches, people that can go to work, but of course within the lockdown restrictions of not having more than half of the capacity of any entity that holds people at a time.
What over here in Ghana, one of the biggest problems for us is adherence to the COVID-19 protocols, and so we haven't had any the sort of restrictions that we've seen in South Africa, including we've only had one lockdown, for example. But to what extent do people comply with these protocols? And after that, we go into the conversation about the vaccines.
Yes. So South Africa has had one of the most stringent lockdowns worldwide compared to the whole world. I'm sure you remember at some point that actually banned the sale of cigarettes because, COVID-19 is a respiratory lung disease. People just wouldn't be allowed to go to work. The curfew at the moment is between 11 p.m. and 4 a.m., which is one of the most relaxed that we've had for a very long time. We've got certain areas within the country that is a bit more resistant when it comes to obeying the lockdown regulations, like your Western Cape province, which ironically is actually one of the provinces that has one of the highest numbers of people that are infected with COVID-19. Just recently, we had protesters going to the beaches. It's a coastal city in Cape Town, protesting that their civil liberties are being infringed on by the government, by them not allowing them to go to the beach. So we do have a few people that are starting to have what is called a COVID-19 fatigue in terms of adhering to wearing a face mask, observing social distancing, and observing all the rules and regulations that have been put down by the government.
Let's talk about vaccines. Think about last week. I was just watching the news with so much excitement when South Africa received the first tranche of the AstraZeneca vaccine. And just about yesterday, I was watching the news again, and I understand that it's not as the efficacy level doesn't seem to be working very well with the apparently local variant. Educate us a bit more on this development.
That's exactly how we felt here in South Africa, because the government had told us that would get the first batch of 1 million doses that actually arrived just a few days ago. About 6 days ago, we received the first batch. But just 2 days ago, we then realized that that batch is actually expiring in April. That's in a few weeks' time. And not only that, the most devastating news that we heard is that this particular, it's called AstraZeneca COVID-19 vaccine is not actually, its efficacy levels are not really strong when it comes to the variant that is unique to South Africa. But then, of course, you can't blame the government for that, because that time they procured it, they were still dealing with the first variant. So the decision that had to be made by the government was to stop the whole vaccination program, which was supposed to have started in about 2 weeks' time, while they do more research and more, efficacy tests to make sure that, people get the right medicine. At the moment, we're looking at Johnson & Johnson. They've come into play. They have promised that they will be able to give us a batch of a vaccine that can actually match up to the new variant that we have here in South Africa. So we're hoping that that will happen soon. The government had procured close to 20 million dosages of this. There's another 500,000 that we're expecting to come in the next couple of weeks, which again does us no good when it comes to the efficacy levels of the variant that we have here in South Africa. So it was a bit of an embarrassment on the part of the government to have to deal with that, particularly with the issue of it having to expire any day now. So what they've done is they've gone to the institute that supplied us with that vaccine to see if they can return the batch so they can get a new one that is a more extended date when it comes to the duration date.
Well, I'm very hopeful that that process, will go on smoothly and that they'll be able to have that nice exchange. But the public reactions, I'm wondering what it has been to this false start.
Huge disappointment, a lot of criticism that is coming from not only opposition parties like the Democratic Alliance, but just, having the confidence in the public. They seem to have waned. The public doesn't seem to have as much confidence in the government as much as they had a few days ago, considering that we literally had the president of the country go to the airport and receive this batch of vaccines that we had been promised, that this is our lifesaver, and literally inspected it in front of the whole world, in front of the whole country, and told us that, this is the hope that we've all been waiting for, only to find out that we've been sold a dud. So a huge disappointment, a lot of criticism that is coming from opposition parties. They've now written to Parliament saying that we want the government to account how they could have lapsed in such oversight in terms of, procuring a vaccine that is going to expire any time now. But the explanation that has come from the manufacturers is that given, the clinical test that they've done at the moment, they can only give an expiry date of end of April, and they can't help us with anything at the moment. So the country is looking at other manufacturers to see if we can get other batches. But now we're looking at taxpayers' money. Over 40 million rand that was used to procure this seems to be going down the drain anytime soon. And I can tell you that the citizens are not happy at all.
Well, like you said, they're trying to figure out this arrangement where they can have this exchange. So hopefully that works as well. But what does this do to all these conspiracy theories that came up? Because people were apparently apprehensive about doing the vaccine in the first place, to think that it came in, and then the concern is that it doesn't really address the problem that we sought to do. I believe that this will have an impact on the conspiracy theories that have been going around. Is it?
It has actually been called, the second pandemic that we're having to deal with, especially here in South Africa. The conspiracy theories about the 5G having, precipitated this COVID-19, Bill Gates, and pharmaceuticals that are trying to profit by actually creating this virus so they can provide and supply the vaccine. And now a lot of people have a lot of doubts in their mind. I'll tell you about a study that was recently done here that suggests that only about 52% of citizens here in South Africa are willing to take the vaccine. So the government needs to take that into account, considering they're looking to have what is called a herd immunity. That means immunizing at least 65%, at most 65% of the population, to make sure that they have a hold and curb this COVID-19. But from the looks of things and from the surveys that have been done, it'll be difficult to get to those numbers. So a lot of campaign awarenesses have to be done from the government to make sure that people understand why this is important. But given the recent events, of course, that we've already alluded to, of having vaccines that are expired, people are already worried about, the reactions. I'll take you back to the vaccine trials that we had here in South Africa a couple of months back, as they were trying to ascertain which type of a vaccine is appropriate for people that live here in South Africa. And there were a bit of side effects that people experienced. They were mild. No one died that we know of. There was no report of anyone dying, but people complained of muscle pains, of headaches, nausea, and red patches, where they'd gotten the jab. So such fears have really not helped with the conspiracy theories. And really, there hasn't been transparency. And this is what, others in the government have been calling to say, we want to understand what plan you have with regards to this vaccine, not only the procurement process, but also raising awareness on who you're dealing with, who you're paying the money to, and why you chose those people.
Transparency, you say. That before you go, the WHO is saying that this should not hurt the confidence so much because all is not lost. Apparently, there are further tests that should lead to the conclusion that this can actually help for people in severe or people with severe COVID-19 infections. What can you tell us about that?
That is actually true. Yes, that is actually true, that AstraZeneca actually helps those that have, severe symptoms. But looking at the number of people that have been infected here in South Africa, most of them actually have mild symptoms. So you would expect that the first batch is actually going to help those. So that is where the problem starts. So it is not all lost, but the number of people that it would service is really a drop in the ocean compared to the number of people that they were hoping to service and make sure that they have access to this vaccine. The government spoke of a 3-phase plan when the vaccine comes. Phase 1 that concentrates on the healthcare workers, that most of them, obviously haven't really been affected. We've got a huge number of people that have been affected, but most of them haven't. Healthcare workers to be the first ones to get vaccinated, and thereafter we get to the elderly and to people that have comorbidities like your HIV, your diabetes, and your blood pressure, and people that are in prisons as well, people that congregate in closed spaces. So looking at the doses that have come so far and the efficacy levels that it has, it doesn't really help the majority of people that have been infected. Only a small number of people have severe symptoms here in South Africa.
Well, I'm hoping that the lessons that have been learned will be applied in the next procurement, hopefully. But if I were to ask you to advise, to get a South African advice for Ghanaians who are anxiously waiting for our own tranche of our first batch of vaccines, what would that be, briefly?
Learn from our mistakes. That would be my first advice to you. I think the advantage of not being the first, South Africa is considered to be one of the richest countries in Africa, but I think it's safe to say that, mistakes are expected to happen. This is unprecedented to most governments. They're still trying to figure out how to map out the logistics, the distribution, making sure that it's safe, making sure they get the right vaccine, that is not going to expire. So I think a lot of work and research needs to get into the logistics and really just learning from the mistakes of others that have started before you, such as South Africa.
I'm certain that our authorities are learning from the South African experience. Audrey, thank you so much for elaborately breaking it down for us from there. Audrey Chimwanda-Twala is a journalist and an anchor with GAN TV in South Africa, joining us live all the way from there. Well, will we learn from that experience? Let's hope so.
They took everything we had and even disconnected the things in the ambulance and demanded money.
That's an inconsolable Priscilla Otibu, the then pregnant woman who was on board the ambulance that came under attack last Thursday by highway robbers. It was an attack that began after midnight and lasted 4 hours at a remote part of the Aseseso Edukrom Road, during which the robbers shot and killed ambulance service personnel Abraham Tete Humeku. The emergency ambulance team was conveying Priscilla from the Akuse Government Hospital to the Eastern Regional Hospital in Kufuja after she suffered complications in labor. She tells JoyNews 9 armed men accosted them in the middle of the journey and opened fire at them.
They took everything we had and even disconnected the things in the ambulance and demanded money. There were about 9 young boys. They took everything we had and disconnected the things in the ambulance and demanded money. There were about 9 young boys. We were held at gunpoint from about 1 a.m. to 4 a.m. They took my phone, which had 1,700 cedis on it. They took everything, including my mobile money pin. I started shouting, but the nurse urged me to keep quiet, otherwise they will shoot me. When I went to the hospital today, they didn't tell me the driver had died. I was told yesterday, and when I heard it, I fainted. If not for me, someone's child wouldn't have died like this. The death of the driver is what even hurts me the most. I think it's all my fault. If not for me, nothing like this would have happened to him.
She's dealing with the trauma, she's dealing with taking care of her kid, and she's dealing with the stigma, and she's dealing with the emotional burden of feeling that she is responsible for that person's death. In the meantime, the acting public relations officer for the Eastern Region Police, Francis Gumado, says they've picked up intelligence on the suspects and are tracking them.
No arrest has been made, but yesterday there was a team of policemen led by ASP Danso, who is the Educom district officer, to the enclave where the incident happened. So they went and combed the place in search of these alleged robbers. But unfortunately, all the places that are noted to be a settlement for the Fulanis, they all vacated the area. The areas leaving their animals alone. So we are still picking some intelligence, and we hope and pray that we should be able to get some people arrested in connection with this heinous crime. So investigations are ongoing, but just that we've not made any arrests yet. In terms of lead, yes, we are following a lead. But lead in itself is not concrete. Are you getting me? Will lead to positive results. Some will actually lead to nothing. You understand? But all the information available to us now, in terms of description and some pieces of information that we are picking, we are moving on them. And we are only hoping and praying that we should be able to make any road. Well, actually, any victim of robbery will be taken care of in a certain way. So those who actually suffer some torture or what have you, assault, whatever, they have been given medical forms to attend hospital, and that is how far we've gone.
Let's speak to our correspondent, Eastern Regional Correspondent Maxwell Kudeko, who has been on the beat for us since last week. Hello, Maxwell. Maxwell, what is the latest development on this particular story?
Well, we have had conversation with Otibu Prisla, the preterm mother who was in labor, and the paramedic who was also on board the ambulance. The two are still traumatized, and it's becoming very difficult to live up to the reality that something happened. Now, Otibu Prisla and then the Otibu Prisla and the paramedics tells us that they have not received any call or telephone conversation with the police with respect to gathering of information as to getting lead to arrest the perpetrators. The police have not reached out to them to ascertain what happened, especially with respect to the incident connecting to the shooting of the ambulance driver. Now, it is also on record that the armed robbers managed to seize the phones of the preterm mother and her sister, and then they took the PIN code, that's the mobile money PIN code. She claimed that they had an amount of 1,700 cedis on it, so they picked the phone and collected the PIN code. So it is assumed that there may be a transaction on that phone, which could be a lead for the police to start to trace the perpetrator. But they have not been contacted so far by the police to gather some of this information, which will lead in apprehending the perpetrator.
So as of now, as of I think about 12 p.m. today, they hadn't received any call from the police. They said, as of now, has that story changed, or is it the same?
The story remains the same. They have still not received any call from the police. Now, the difficulty is that Otibu Prisla is domiciled somewhere around Esukare. It's a bit. It's not too far from Esukare. The lady is being stigmatized by the community. Yesterday, she complained that the community people are pointing fingers at her, that the ambulance driver was shot because of her. Had it not been the fact that she was being transferred from Akose to Kofodia, the driver would not have bumped into the robbery and then lose his life in his bid of saving her. So that has also been a very sad situation for the lady. She's been home since yesterday when she went for treatment at the clinic at Esukare. So that is also a matter of concern to people around the lady, that the community have started more handling her, even though she suffered a lot of trauma and she went through so much pain during the incident.
And is she getting any help? Yesterday, that the director of the ambulance service indicated that the paramedic who was on board the ambulance had, some clinical psychologists talking to her. Is Priscilla getting any sort of help from the clinic?
Well, so Priscilla, according to her, she delivered at the Kofodia, the Eastern Regional Hospital. After delivery, we are told that her condition was not too stable with respect to his mental stability. So she had some kind of counseling from the clinical psychologist, and she was somehow stable. But after she was discharged from the hospital, she's not had continuous counseling.
But the ongoing strike by importers and transporters of tomatoes has caused a shortage of the commodity at markets in Kumasi. The importers embarked on the industrial action, protesting violent highway robbery attacks on the Kumasi-Bolgatanga Burkina Faso route. Access to tomatoes for the retail market is becoming a tedious task for traders since all vehicles have been grounded. Nana Yaojima has been speaking to traders of tomatoes at the Swame market and has this report.
In recent times, importers and transporters of tomatoes have come under highway attacks. Some have been killed and others maimed while traveling to neighboring Burkina Faso to import tomatoes. In the past 1 month alone, 2 people have died and 8 others injured in robbery attacks on the highway. To draw attention to their security concerns, the Tomato Importers and Transporters Association embarked on an industrial action last Friday. Emmanuel Oseitufo is leader of the group.
We are going to park our vehicles. There won't be any tomato coming from Burkina Faso to this country. It's only the military escort can save our lives. If not, we are not going.
Before the recent action, retailers were recording challenges in accessing tomatoes due to reduced importation for fear of armed robbery attacks. Tomato retailers have had to adjust their prices to make up for the price hikes.
We had to track down a vehicle from Burkina at midnight before we were able to secure some tomatoes to retail. If they go on strike, it will affect our business, but they have to do so because their lives are at risk.
We used to sell a pile at 5 cedis. Now it's going for 10 cedis, and our customers are not buying because it's expensive. They are getting rotten.
60 and 50.
If they go on strike, we will go hungry, but they can't risk their lives. Their wives and children will not allow them to travel on the route and die.
From Kumasi for JoyNews, Nana Yaojima reporting.
Let's do sports up next.
Thank you for staying with us on The Pulse. I'm Gary Al Smith, and this is The Sport. The Ghana Football Association is urging clubs to contact the Ghana Police Service to ensure that COVID-19 protocols are well observed in big games, or what they call Category A games. However, most club venues are finding it difficult to control their fans and to compel or encourage them to adhere to the safety protocols during this pandemic. Communication Director for the GFA is Henry Asantichum.
The 2020-2021 football season commenced in mid-November last year as matches were played behind closed doors due to the spike in COVID-19 cases. However, in January, fans were allowed to return to the various stadia after government lifted the ban on a condition that only 25% of fans will be allowed with strict adherence to the COVID-19 protocols. In the last 15 days, Accra House of Folk, Mediama Sporting Club and Kerala United have failed to enforce fans to adhere to the protocols at their respective home grounds. As a result, the aforementioned clubs have been penalized by the GFA to play their home games behind closed doors until the disciplinary committee comes out with a ruling. The Ghana Football Association Communications Director, Henry Asantichum, believes the culpable clubs have themselves to blame.
For the start of the league, we put a document together. The medical committee of the FA, led by Dr. Baba, put a detailed document as regards the role of clubs and the safety and security officers of the various clubs. House of Folk versus Olympics, that was not respected. So the issues are different. The House of Folk Olympics game, there were multiple of, indiscipline. First of all, they sold more than the allocated tickets of 25% out of the 40,000 capacity. That was wrong. Secondly, social distancing protocols were not followed judiciously. When Mediama played against Hearts of Folk, yes, we had our eyes at the Akun Park in Takwa, and what we observed was that Veronica buckets were provided, fans were in nose mask, but as soon as they entered the stadium, some of them removed it. We have seen pictures where the fans is either they've dropped it to the jaw level or they don't have it at all. And they were sitting side by side, toe to toe. Those who were standing, at the other side of the pitch were also close to each other. It's not that we are against anyone. It is not that we hate any club.
The flouting of the COVID-19 protocols has been blatant, especially in big games, namely the Manchester Derby between House of Folk and Great Olympics, Mediama Sporting Club's 1-0 win over Accra House of Folk, and Kerala United's loss to Asante Kotoko in Anyenase. The above games show that clubs are finding it difficult to control the number of supporters who troop into match venues and also to enforce the observation of COVID-19 protocols. Henry is urging clubs to collaborate with the Ghana Police Service to ensure the adherence of the protocols.
Your responsibility is to write to the police unit and request for police personnel on match days. Now, the first thing you have to do is to submit a copy of the fixtures for the whole year. So in our situation, for instance, we have category A matches, we have category B matches, and then category C matches. These things are known to the clubs. I mean, I don't want to believe that a club like Mediama does not know the category A games that they have. They know that when they play Kotoko, it's a category A game. When they play House of Oak, it's a category A game. When they play Dreams FC, it is not a category A game. So mostly, the police personnel that we normally request for differ. They don't, you cannot request for 13 police officers for a game between maybe Dreams FC and Ashanti Gold, and request for 13 police officers for a game between Ashanti Gold and Asante Kotoko, because the two differ. They are not the same. The expectation, the pedigree, the euphoria, the hunger, and everything that go into such big games differ from an inter-allies Dreams FC match.
After week 13 of the Ghana Premier League, Asante Kotoko lead the pack with 23 points. Kerala United are in second with 22 points. Bechem United, Great Olympics and Ediana Stars complete the top 5. Brekum Chelsea, King Faisal and Inter Allies are languishing at the bottom of the table.
Yeah, that's the sport for now. Thank you very much for your time. Gary L. Smith here. We'll be back with more during Joy News Prime.
Before we go, the Supreme Court has adjourned its ruling on the argument by counsel for the petitioner that witnesses of the first and second respondents be compelled by the court to take the witness stand in the ongoing election petition. This follows a decision by the counsels for the first and second respondents not to call forth any witnesses to adduce evidence in court in the matter before the Apex Court. Yesterday, the counsels for the two respondents cited Order 38, Rule 3E, Sub-Rule 1 and 5 of CI 47 as amended by CI 87 as the basis for their decision to close their case and not call a witness. Going into details today, both counsels told the Apex Court that they had expected the petitioner to be happy with their decision since it works in their favor. Lead counsel for the EC, Justin Amenuvo, supporting his argument with Section 62 of the Evidence Act, held the view that the court cannot compel his client to testify against her will, while lead counsel for the president, Akoto Ampao, maintained that the burden of proof lies with the petitioner and not the respondent. But disputing these arguments, lead counsel for the petitioner, Chachuchi Kata, said since the lawyers have not made a submission of no case, the burden of proof does not apply as argued by the lawyers for the EC and Nana Addo Dankwa Akufo-Addo. The case has been adjourned and will be heard on Thursday. And that's it for today. There is more news at myjoyonline.com. This video and this show, by the way, is on demand on our YouTube channel. Do log on to that one as well. My name is Gifty Ando Apia. Have a good evening.